everyone. Thank you so much for joining us. We're so excited that you're tuning in your time to talk about a bigger conversation about people and pets. We have been hosting a series of town halls with Human Animal Support Services leadership, many of which are on this call today. And this call is going to be really tailored to talking about how HASS means helping people too. I'm so excited. My name is Bobby Mann. I'm the Maddie's Human Animal Support Services Pilot Coordinator, and I'm going to be co-facilitating this call with Dr. Jyothi Robertson. So I'm going to toss it over to you, Jyothi. Maybe you can do a quick intro, and then we'll intro the rest of our rock stars.
Thanks a lot, Bobby. I'm Jyothi Robertson. I'm a veterinarian in shelter medicine space, and I am a consultant. And for HASS, I sit on the governing management committee and maybe a couple other committees as well, including research. And it's a pleasure to be here today. Maybe we could do a little round robin and a circle of introductions. We can start with Dr. Fisher.
Absolutely. I did not expect to go first with this group, but I'm Josh Fisher. I am the Director of Animal Services for the City of Charlotte and Mecklenburg County in North Carolina. I also am the current sitting president of the National Animal Care and Control Association and sit on the HASS Managing EC with Jyothi.
And then we can turn it over to Dr. Blackwell.
Hi, my name is Michael Blackwell. I'm the director of the Program for Pet Health Equity, University of Tennessee. Our mission is to improve access to veterinary care, and we're looking forward to spending some time with you.
Sounds good. And then we can round it out with Geraldine.
Hi, my name is Geraldine D'Silva, and I'm the Director of Community Veterinary Services at San Diego Humane Society. And I'm also on the DEI Advisory Board, and I lead the HASS One Health Working Group.
Geraldine, speaking of One Health, and thank you so much for bringing that up, as we broaden the conversation about just the interaction of helping pets, we really love to frame it around the concept of One Health when we're really supporting people, pets, and the environment. Can you sort of frame One Health for people and tell us why you think it's so important that it's part of the HASS model?
Yeah, absolutely. I am really passionate about it, even though it seems like One Health has become the new buzzword. But really, when we think about One Health, it's really considering people, animals, and the environment in the context of One Health, because it's all interconnected. And from the animal welfare perspective, we are trying to provide interventions to keep pets in homes. But when we try to address the needs of these pets and remove barriers, we have to consider the fact that the humans that they're with are also, facing all these barriers. And these barriers are related most often to their health. And that's where, social services and healthcare agencies come into play, because it's the same people that are trying to access care and resources for their pets that need the same thing for themselves. So really, with One Health and within our One Health working group as well at HASS, we're trying to kind of help provide creative solutions, as well as try to provide guidelines to people to help them change their model in animal welfare in their agencies, so that they can take the first steps towards creating partnerships with social services, with human health agencies, and really even trying to think about how do I take the first step? What are the questions that I ask? Is it okay to ask these questions and advocate for these humans that need help with their pets? And even trying to put pets into the consideration set when they're thinking about helping humans in the social services sector. So, it's all connected at the local level, at the national level, and at the global level eventually. And we're hoping that in animal welfare, when we start in a small way at HASS, we can ultimately make a larger impact.
Wow, that was beautiful. Jyothi, do you have anything you wanted to add?
Yep, I'm curious, Geraldine, how you have navigated some of these solutions that you're talking about, and if you could speak a little bit more to that idea of this integration between the human and the animal, and that that bond, which I know, again, Dr. Blackwell will speak to as well in more detail, but if you could touch on that a little bit.
Yeah, I think I can speak like in the framework of where we first began when I was the executive director at PAWS, which was an organization that helped homebound people keep their pets. And these were people that were terminally ill, chronically ill, and disabled. And when we did a survey with them, we found that the reason that they wake up each morning was because of their pet. And so the human animal bond cannot be understated. And we tried to find creative solutions within the limited resources that we had, because we felt that if we didn't provide those resources, they would be left isolated and alone without the only companion that they had. And so this led us to respond to the needs of people, whether it was people walking in to our office, whether people were calling in, or whether it was just a referral. And if it wasn't within the scope of services that we had, we would make the phone calls for them, or we would utilize our volunteers to make phone calls to a case manager, or to an emergency boarding facility, or to a healthcare worker. And we found that yes, often people would say that, they didn't have any services available. But, there are good humans out there, and there are always people that are animal lovers out in human services. So we can tap into that. And when we make one contact there, that can have a ripple effect. So we have to keep that in mind. And just hearing a no once in a while shouldn't prevent us from trying to make headway into the social services sector. We've attended human service conferences where we've been the only ones from animal welfare. And, I think that has made an impact, because from the social services perspective, they were wondering why animal welfare was even having a seat at the table. But now that it's changed, because there are so many more people that have a voice there. And fortunately, one thing that's come out of COVID and the pandemic was that people are thinking more laterally in terms of how we can help the whole family unit, because just helping people alone or animals alone is not going to solve the problem.
Geraldine, thank you so much. Dr. Fisher, I'd really love to bring you into this conversation before we move forward, because I think something that I really love that Geraldine brought up was helping people in crisis, right? And as much as we want to automate our work and streamline the things that we're doing, we really have to slow down and be able to support people and meet them where they're at. As a leader across the country in field services and sheltering, how do you define success on, when we're trying to help so many people and you're having to slow down to really meet people where they are? How do you have that conversation with your staff about what is winning at this?
Absolutely. So winning is just like so much else that we do. It's a case-by-case basis, right? And you have to count every single case that you help in some way. And I think that we've really learned through this process to expand our definition of what a success is, of what a positive outcome is, and really look at each individual interaction and how we can tailor our services to that individual interaction. There's been so long in so many industries, but animal welfare in particular, that we have focused on, policies and procedures, and everything has to fall within this cookie cutter shape. And that's just not realistic. And, really one of the major changes that we've made is with our field operations teams in particular, is getting them to move away from that traditional animal control mindset and more into a casework mindset. They are handling each interaction as that individual case that they are working, and they're looking at all different facets of that. Like Geraldine said, we're looking at the human side, but also the animal side, and how the different services that we as municipal employees or employees that have a municipal contract or with a nonprofit organization that have those connections that the general public is just not as adept in, because we've been doing this for so long and we have made all of these connections. It's time to step up and leverage those.
I love that. And I know later on, we're really going to talk about your tactical approach that you took to just revise your structure of your organization. But Jyothi, I wanted to toss it back over to you to continue the conversation.
Yeah, I'm really intrigued by how both of you, are really talking about the keeping the pets at home. And when I think of One Health and the family bond, I really think about Dr. Blackwell's work and how he's brought in really that notion of pets and family bond. So, Dr. Blackwell, if you don't mind, could you please tell us a little bit about your work at Align Care and how it integrates with what you just heard both Josh and Geraldine referring to with that bond? And then could you also expand that out to really talk about what access is as
Sure,
well?
thank you. And what I'm about to say very much integrates with what we've been hearing. So a bit of a repeat, actually. I want to set a context, though. The context of our work is this. Upwards to 2 out of 3 households in the United States have pets. And 90+% of those families consider the pet a family member. So we live in a society made up of what we call bonded families. Now that's acknowledging that human-animal bond as defining that social unit. And just for reference, less than half of our households, really about 40% only, have children. So we are a society of bonded families. And yet more than 1 out of 4 of these families struggle to access veterinary care. That's based on our national study. Well, why is that? Well, why can't people get care? Well, it turns out the overwhelming barrier is financial. And when we drill down into communities and we look, for example, at animal welfare organizations, I mean, doing as much as they can to address community needs, often getting presented an individual needing assistance and not being able to help, or having to take in another resident into the shelter because of a treatable medical condition. So the animal welfare organizations need some help, the shelters. Well, we keep drilling down and we say, well, they have been reaching out to veterinary practices, for-profit veterinary practices to help. And that's not always gone well for multiple reasons. And so the work we have been doing over the last 4 years was to actually build a One Health healthcare system. It's the first in the United States. One does not exist to operate nationally in the United States, whether it's coming from the human side or the veterinary side. We're proud of that system because we think it's going to actually influence the human healthcare system. And that's because we are so connected as a society of human and non-human members. So Align Care was built to address what are the key barriers. And, it turns out the barriers are not caused by the pets. We couldn't find a barrier that they were throwing up. No, they're all human factors, human realities. And so a healthcare system that is going to improve outcomes must a priori be focused on the humans, on the people, the pets people. And it's not just the family who are the pets people, it's the veterinary care team that's the pets people, and any and everybody else who has the potential of impacting that pet's well-being. So a structured healthcare system that better ensures access to veterinary care, and that in part happens because of subsidized healthcare. So at the end of the day, the families don't have enough money. The veterinary practices can't give away the shop. They can only help so much. So a healthcare system that subsidizes the healthcare is what's needed. It's not novel. That's what we have on the human side for the same reasons, involving the same families, that kind of support. So that's what Align Care is. The biggest difference between the human side of public assistance and Align Care is Align Care is not based on tax dollars, tax programs. It's based on private sector compassion for members of the society and the fact we have so many who want to help. So definitely a One Health healthcare system.
Thank you so much, Dr. Blackwell, for framing that well. And we have a trifecta with Josh and Geraldine here of folks in you that are really providing that external facing medical care, that access to care. So Josh and Geraldine, I'd love to open it up to either of you if you want to continue on with what Dr. Blackwell was discussing or kind of frame it in your own way.
Yeah, I love what both Josh and Dr. Blackwell said. And I think to add to it is like trying to bring in the concept of like, in underserved communities, people still need to be aware of preventative care, because most often when their pets are in a crisis with their health, that's when they're looking for help. And then they live in a resource desert with no vets around. And then they don't have transportation to get to a vet. So then there's a new barrier. And then the fees at a vet office are so high. And then that's a new barrier. So, it just kind of escalates. So I think like a large part of what we do is also educating, or I shouldn't use the word educating, is sharing information really on what we can do for our animals that are part of our family, so that they don't end up in a situation where we cannot afford to take care of them. And that leads into other aspects of diversity, equity, and inclusion, which is also something that everyone talks about, because in underserved communities, we found, again, using the term resource deserts, they don't have access to care. And that's why the work of Dr. Blackwell is so important, because we're going to address those resource deserts and give people access directly where they are. And then, of course, in addition to that, there's the language barrier. So we need to keep in mind that we are addressing that. There are the cultural barriers. So we need to make sure that we're not, taking a stance where we feel we're teaching people what they need to do. We need to understand where they're coming from and why, for instance, they don't want to spay and neuter their pet, or why they would like to have a litter of puppies. It's about having conversations, getting on their page rather than trying to get them on our page, and eventually we're all on the same page.
Geraldine, you mentioned diversity, equity, and inclusion. I wonder if you could elaborate on that a little bit for those people listening who might be wondering, why should we be thinking about DEI in this space?
Yeah, I love talking about it. I'm a person of color, and I am often in a situation where I feel like I try to make myself understood. And I don't have a language barrier, and I don't have a financial barrier. And when we work with underserved communities, we find that often, even asking for help is so difficult. And so we try to kind of have a non-judgmental approach, because we find that when we go in thinking that, these are communities where they might be able to learn from us, it's not really solving the issue. So we need to consider the fact that people have different backgrounds, they have different upbringings and different beliefs. And at the end of the day, if they love their animals, that's the one thing that is common with all of us. And I think we can use that as the common ground when we come from the approach of animal welfare and trying to keep people with their pets.
And Geraldine, just always listening to you, I'm constantly learning, and just life lessons. And just an example of that is when you went from using the word education and reframed it in the middle of your conversation and said sharing information. Those are all learning experiences for all of us, right? So as we're walking through this space, we're really trying to change the culture, not only our words, but the way that we feel about the work. And I feel like someone who's done a really great job of that is Dr. Fisher within his organization, because as we are moving from more of a punitive animal services to a supportive animal services, there's also a perception that there's going to be a really hard pushback from old school animal control officers. And so, Dr. Fisher, how have you navigated through that space, and how's it going for you?
Sure. So we definitely have thought, there's going to be some pushback from our industry, and, good, bad, or otherwise, there's this mindset, I guess, that there's the good old boy, old school animal control, right? And that does exist in pockets. And what we are finding is that those pockets are smaller than any of us ever thought. This is an industry that we get into because our hearts are in the right place. You don't last very long in this field if you don't have compassion, right? And I think Geraldine said it in probably one of the most perfect ways that I've ever heard it when she said, we need to get on their page. And sometimes we need to get in their book before we can get on their page because we're that far off. And so it's really a matter of starting with those conversations and as leaders within this space, resetting how we're approaching it initially, because I think that some of that fear of what the old school mentality is going to be is just that. It's a fear on the leadership's part. And we are asserting some opinions that we have in our head on people who may not have those, right? I will say I have been absolutely shocked by some of the officers that I've worked with that I was, candidly had prejudged and was thinking, they were going to be the holdouts. This is going to be the officer that just isn't willing to buy in. And they have truly been some of the most influential and active casework approach officers that we have. They'll come in and they'll stand and argue with our veterinary team and our surgeon about, what she can and can't do and what she should and shouldn't do to provide service to the community, because they're like, no, we need to do more. It's important that we do more for this case. We can't stop at that level. And I think the other piece of that too, that Geraldine really hit on was the preventative care piece. So often our industry, just by nature of what we do, is reactionary, right? So animal control, veterinary medicine, a lot of times we are in situations that we are, in the animal control side, we're call for service based, right? So we don't go out and do something until somebody calls in and requests assistance of some kind. And it's really important that we take that step back and we look at what we're doing from that holistic approach that Dr. Blackwell and Geraldine and Dr. Robertson have all talked about, in that, we can't pigeonhole ourselves into, well, we're just going to provide the preventative services and not help with the crisis. We're just going to help with the crisis and we're not going to help with the preventative. We've got to be able and be willing to do a little bit of all of it, because the barriers that each individual faces are different. And those barriers might be preventative. And so if we can help with that preventative service, we may be able to avoid the crisis, right? They may, on the flip side, be able to handle that preventative, that, baseline care of their own volition. And it's the crisis that's the challenge for them. So we really just have to be open to taking it as it comes and handling those cases as they come to us. And, again, as Geraldine said, meet them on the page they're on. We've really got to take that step back and take ourselves out of it, take our personal preconceived notions out of it. And that's hard, but it's something that I truly believe this industry is better at than just about any other, because of the place that we're starting from.
Thank you, Dr. Fisher. There's a couple kind of takeaways that I had from that is when, the one thing that used to unite us as a field before was just how we felt so judged by our communities about not being life-saving organizations, and how we asked them to get to know us as people and not judge us. And then we often have been doing the same thing with a lot of our field services officers and making these assumptions. So I definitely appreciate leaders like you that are really taking that step to build not only those external relationships, but those internal relationships. But Jyothi, I wanted to send it back to you. Just, this equity conversation and diversity, equity, inclusion is such a big part of just this entire part of helping people. So where would you take this conversation?
Wow. I mean, a few things that Josh said just really resonated with me, and also highlighted something. What it highlighted is the lack of diversity in our animal shelters and in our structures, right? Because if you heard him closely, there was an other, right? There was them, the officers, and then there was the other, and they were communicating with whomever that other is. And when we have a lack of diversity in our field and in our shelters, what we see is that we're missing voices. We're missing very important voices. And it's not just having those people at the table, it's them being able to fully participate authentically there, right? So that's where inclusion, belonging come into play. So that when we have organizations that not only are representative of our communities, but representative in a way that allows for the conversations that Josh and Geraldine and Dr. Blackwell are talking about, that's when we can get to equity and justice, right? That's when we can unravel hundreds of years of systems and structures that we're being forced to work within, because that's the reality of what we're working within, right? And so I think that's really important to keep in mind, that underlying One Health is a whole diversity, equity, inclusion, belonging, justice conversation that needs to be had. And when it doesn't occur, you end up having a superficial conversation about us, them, helping, like kind of at an external level, which to me is unfortunate, right? And so that's why, and I might be taking this in a completely different tangent than what you were thinking, Bobby, but I just think it's so important that we recognize that we're working within structures that are inherently not diverse, that where people haven't been able to be authentic and speak, like be fully present. And so what does it look like to open that up in order to keep pets with their families, in order to support the human animal bond, in order to elevate like our way of thinking and being in our profession.
Yeah, I think that is a perfect example of the diversity conversation, right? Is to have more lived experiences, more lenses, to be able to have more sort of views of certain conversations, because all of us are here, we're able to bring more to the table. And I think also a big part of it, and I'd love to, Dr. Blackwell, get your thoughts on it, is as we are walking through this space, we are walking through it with giving people some grace. There is absolutely growing pains that are going through this, and us being able to have these healthy conversations in this space is because of the trust building, right? We can openly say these things to each other and have the accountability conversations because we are all trying to walk toward the same path and growing together. And thank you so much for sharing that, Jyothi. And so Dr. Blackwell, did you have thoughts as well?
Sure, and I'm certainly enjoying everyone's perspective. I want to add another facet, though, to this conversation. See, I see DEI, diversity, equity, and inclusion, as verbs, not nouns. They're action terms. Within an organization, we want to achieve cultural competence, meaning an understanding of the communities that the organization serves. The communities translates into the people being served. And organizations adjust their policies and procedures in order to be in sync with the needs of that community. Now, developing those policies and procedures really require input from representatives of that community, preferably as employees, people who are helping to bring that about. That's on a micro level. That's on an organization level. We need to also think of DEI from a systems level, from a community level. So let's take animal welfare organizations, highly committed, highly motivated, but this big societal issue of lack of access to healthcare. You need a diverse group of entities to fix that. It can't be fixed by just animal welfare. Well, let's add veterinary medicine in. Oh boy, veterinary medicine on a diversity standpoint, from a diversity standpoint, our model was built for a thriving middle class. It was a good thing when we had a thriving middle class that we could build toward for. So when we start to see our society in its full dimension, and not everybody is a comfortable, solid middle class family, but yet those who are not really deserve access to healthcare, the human and non-human members. That takes a diverse business model. You can't have a cookie cut approach. And what does that look like? Well, I shared this in a couple of presentations just this week. Veterinary medicine doesn't operate as a system. It operates as discrete sole proprietorships, entities that are connected under an umbrella called the veterinary medicine profession, and more corporates now and some nonprofits. But there is no system, there's no exchange of information, growing of databases, so we come to understand what the community needs are. And so, yeah, I think DEI is what we must build on, but let's make sure we understand, boy, it's way beyond just race and representation by race and gender, sexual orientation. These are the things that get talked about. They are all important. But on a macro level, it's the diversity of organizations, the diversity of industries that achieve big things in this country. The United States is as strong as it is because of the diverse industries, the diverse people. We can go on down the line. So our industry really needs to think on that much higher level as we think about our organizations internally.
I wonder, Geraldine, listening to what Dr. Blackwell just said, you've worked in as the executive director of an organization that was working in that space. Can you speak a little bit to what Dr. Blackwell just commented on that larger industry scale of DEI, and then also talk a little bit about your experience working within that and trying to make some of those shifts happen?
Yeah, actually, what I love that you're talking about it like at the macro level, Dr. Blackwell. And when I think back to like the organizational level, like two of the things that actually just stood out when you were speaking was, this cultural shift that we're going to have to make as we make our staff diverse is going to take time. And even as that kind of diversity occurs, to actually make that shift in the way we provide services is going to take time. And so that led me to think about like all the training that's going to be needed. And it's not just training for the sake of checking those boxes or to get the funding for that training for like I've checked the DEI training box, but it's things like what we've included in our HASS One Health toolkit, like motivational interviewing. For instance, like, a thing like when someone comes in and they just need pet food, that's an indicator of such a larger problem, because like hungry people have hungry pets. And like, it's about how we have these conversations and not just about, say, giving people a bag of food, and actually engaging, making the time to actually have those conversations, giving them the privacy that they need to have those conversations. And at the core of it is dignity, because that, in addition to diversity, equity, and inclusion, is really, really vital in the way that we provide our services, because providing our services with dignity when people are struggling to ask for help is going to be so important to the way we do our work. And then the other thing is, because we're always talking about us and them, it's their stories that we are telling. And so really, these stories don't belong to us. They belong to the people. And so that brings us to like, the whole concept of ethical storytelling, because we're making all this money through our fundraising, telling the stories of people to make more money, to provide more services. But at the end, we need to remember that these stories belong to them. And when they decide that they don't want these stories to be told, or their situation changes, and so their story changes, we need to be able to respect that. And again, give them the dignity that they deserve. So I know I'm taking it down to the real basics and micro level, but these are little things that eventually have a bigger impact. And I think like, I just wanted to mention it there.
Geraldine, I was just over here snapping my fingers saying, sister. I think just the having integrity in the work and meeting people where they are, and also, never making assumptions. And I think there's a whole other side to this when we talk about access to care and free services and the concept of just saviorism, where I'm going to help you because I have power, versus seeing what people can do and just a sense of pride people can have, even if they can give a small amount, right? I think agencies that I've seen that have left those options open and really allow the person that is receiving the support for their animal to also be a decision maker. I've seen some very beautiful relationships being developed, and thank you so much for bringing up the storytelling as well, because those are very vulnerable moments for people. And from the concept of storytelling, oftentimes something that we also want to do in the equity space is when we are, and this is something that I learned from the team at CARE, is not just using BIPOC pictures for people receiving services, but also pictures of BIPOC individuals that are doing amazing things at your organization and adopting donors, volunteers, staff members, community members, because social media and the visuals that we put out are the lens and the perception that our community is going to receive every single day. As you know, Facebook was shut down for a few hours and the world felt like it was going to end for a lot of people. So we have to be very mindful of those things. But Dr. Fisher, I also wanted to come back over to you because, we're talking a lot about these philosophies and just sort of the way that we should be thinking about the work. But there's also a tactical approach that you need to make in or shift in your organization and staffing to be able to actually do and sustain the support. And you've done an amazing job of that at your organization, of just taking what were animal control officers and allowing them to do so much more. So could you share a little about that?
Absolutely. So first, thank you. We're very proud of the work that we've done here, and it is absolutely a team effort. And I think that one of the things that really helped us was to allow our team members to kind of self-select as to the level of involvement they wanted to have initially, right? So we weren't going in and saying, you're all going to start doing a HASS mindset, no ifs, ands, or buts, because again, we've got to get that organic buy-in in order to have it be truly successful and to have it spread culturally, because that's what we were looking for. We're looking for an organizational cultural shift. We want a different mindset. And our organization being part of law enforcement, there's a lot of different cultural shifts and mindset shifts happening within the law enforcement field right now in general, but then to kind of add that additional animal services layer. So what we did is we really looked at our field operations team and kind of talked about what HASS is, what it means to take that approach. And we had a group of officers who said, I want to focus on that. And so we created a casework, essentially, team, and they were our human animal support services officers. And we had one supervisor who is just, 110% bought in. And that team has grown to the point that virtually all of our officers have some tie-in to it now, which is exactly what we were looking for. We wanted to see that happen and happen as organically as possible, because that's what's going to make it long-term. That's what's going to make it lasting. And that's what's going to make it not just a program, but a way of doing business, right? And with that came introducing our clinical services team to it. And, by nature, veterinarians, veterinary technicians tend to be individuals who want to help, right? That's something that I have worked in corporate veterinary practice, private veterinary practice. I've run the gamut, right? And I am more on the business side of it. And so a lot of the conversations that I have to have with DVMs is, okay, but at the end of the day, you can't give everything away because we do have to keep the lights on. So, there's that space to it as well. And so organically, our clinical services team was much, faster to just everybody's like, yes, we want to do all of it. And sometimes we have to rein them in a little bit. We're like, okay, yes, we want to do all of it, but should we do all of it? And, really kind of walking that line of exactly what Geraldine was saying, looking at it and allowing people to have that voice. We're not coming in and dictating what services need to be provided. We're not coming in and dictating, well, you have to do this, this, and this in order for us to provide any assistance, right? I've seen programs with this that organizations are like, well, we're not going to help you unless you spay or neuter your animal. You have to, also do these things. And to a point, I can see where some of that is coming from, right? We've historically in animal welfare dealt with pet overpopulation, and spaying and neutering has always been that, like, we've got to make that happen. But as Jyothi said earlier, and as Geraldine said earlier, there are sometimes some cultural components to that, some religious components to that, and trying to really understand those and not create these barriers that don't necessarily need to be there, because realistically, if they're coming for help, we're not usually going to be worried about them causing more problems in the space of pet overpopulation. And I just caught myself with the us and them again that Jyothi was talking about, right? And I think that where I'm coming from, I'm speaking of like us as my agency and my entity, and them as our community members, simply from a who's performing services aspect. But I do 100% recognize that I'm using that us and them, right? And I appreciate these conversations with everybody on this call, and I've had a lot of conversations with Jyothi, and I just appreciate the fact that she's willing to call me out and say, hey, you're saying this, right? Because I do try to be very mindful once I've been told what I'm saying. But I am a white man who grew up in the Southeast. And so I've got some, preconceived things that I have to be called on the carpet on and be educated, because Lord knows I'm not excellent at all of it, right? But I'm willing to be taught, and I want to be called on the carpet so that I can learn.
That is fabulous, Josh, I have to say. And I do appreciate the fact that we all have worked together in these conversations, and that we're all growing, like Bobby said. This is a process that we're all working on together. And I think that's really what HASS is about. It's about bringing together so many different groups and different voices together. And so to close us out, it would be wonderful if each of you could kind of give a closing statement, and then we'll end it with our wonderful host, Bobby. So who would like to begin? Geraldine.
Yeah, I can go. I think like one of the things that I would like to mention is, this is a shift that's happening. It's a cultural shift. It's a shift in the way we've done things for so long. And it's okay to slow down. We don't have to hurry. We don't have to make that change tomorrow. We don't have to feel that we need the highest number of statistics and data to report to say we're doing it better, because everyone that's doing it in their own little way, in their small shelter or in their little agency, is doing their best, and that's going to be part of the ripple effect that's going to make this bigger change and impact. So I don't think we're competing with each other, but we're doing it all together. And I think that's also part of this whole inclusion in animal welfare. And I think we have to remind ourselves about that. We can share ideas. We're not stealing ideas. We can work together and have conversations. And I think I'd love to acknowledge HASS, because they have truly changed the culture of animal welfare and initiated this open dialogue between animal welfare organizations. And for that, I'm really grateful. Thank you.
I can go next. So Geraldine said it better than I ever could have, right? And that deep breath and slow down is really kind of where we're at, right? Because we're trying to make lasting change, and that's what it's going to take. It's going to take time. This isn't a flip that we switch that we can flip, a flip that we can switch, whichever way works for you, that we can do overnight, right? This is something that is going to take time, and it is important that we step out of our comfort zone and we try different things. And, we're going to fall on our faces at times, right? We're going to say us versus them at times and need somebody to say, hey, you just said that, right? And be willing to own it and say, oh yeah, let me work on that, and then work on it, right? This isn't something that at the end of the day, we're going to be able to just, check a box and do the training for the sake of getting the grant. This is something that is going to require that cultural shift of our organizations and our industry, and more than just our industry. It is, to Dr. Blackwell's point, so much bigger than that. This is a diversity issue on a macro level, and we have to treat it as such and give it the space and the time to change.
Thank you. Dr. Blackwell?
I'll stay with this theme of change because it's a great one. So we need a change or paradigm shift in both animal welfare and veterinary medicine. Animal welfare organizations, and this is the HASS mission, are, in my mind, are social service agencies in that community, not places where animals go when they are looking for a home or whatever. Although that's part of the work. Animal control is a significant part of work in communities, but it's a social service agency. Now, that alone changes the mindset of who we are. So in the industry, I think we want to ask ourselves, how do we see ourselves? What is our real mission in this community? In veterinary medicine, the paradigm shift is that we're in the business of delivering healthcare to families, not just the non-human members of the family, but to families by focusing on the non-human member. And that by design means that we need to be partnering with those individuals, agencies, and so forth that can help with the human members of the family. Sometimes that's just in communicating. On the equity front, we grappled a bit over the issue of requiring spay-neuter. We don't, in order to enroll in Align Care. And you know what really made the difference for me was, wait a minute, we don't say to the middle class, you can only get health care if you let us do surgery on your family member. I think those who are struggling deserve equitable treatment on that front. I know we've got this idea about overpopulation and we need to save lives through spay-neutering, all very important, but we want to be careful not to impose on additional hurdles onto the people who most need some help. So this is a wonderful time. I think transition is underway. It's palpable. HASS is a big driver in the animal welfare industry. And there are a number of drivers, including our work, hopefully, in the veterinary medicine industry. So this is a good time to be having the conversation.
Thank you, Dr. Blackwell. And as also a data-driven movement, just wanted to also share that we now have over 1,400 organizations that are receiving information from HASS, just webinars just like this. So, it is bigger than just the folks at HASS. We are merely facilitators and hosts. It really is the field that's driving this work forward. And I just wanted to give my sincere gratitude to Dr. Robertson for helping co-facilitate this. Could not have done this without you. My cup is so full. I get to be amongst people that I respect and love and talk about things that are important to me. I would say leaving this, the one piece of advice I would have for folks is be intentional, and take it one step at a time. There's a lot of work to do. Celebrate the small wins. And I think together we're going to make a better community for people and pets. So I think we'll close it out with this, and let's wave goodbye to all the folks listening in and hope everybody has a wonderful day.